Good morning, students. Today you're going to learn about the nurse's responsibility in the administration of antipsychotic medications. Antipsychotic drugs are a class of psychotrophic medications primarily used to manage the psychotic symptoms. They are also known as neuroleptics, major tranquilizers, D2 receptor blockers, and antischizophrenic drugs. The first antipsychotic medications were introduced in the 1950s. Now, let us see the classification of antipsychotic medications. They are spread into two broad categories, namely the typical antipsychotics and atypical antipsychotic medications. The typical antipsychotic medications, they have high potency. To name some, haloperidol, chlorpromazine, fluphenazine, trifluoperazine, thyroidazine, and pimoside. Atypical antipsychotics, they have low potency, clozapine, olanzapine, risperidone, quetiapine, and ziprasidone. Indications of antipsychotics. For functional disorders, schizophrenia, schizoaffective disorders, paranoid disorders. Given for organic disorders, for delirium and dementia. Mood disorders, mania and depression. For childhood disorders, attention deficit hyperactivity disorder, ADHD, autism, conduct disorder. For neurotic disorders, namely anorexia nervosa, intractable obsessive compulsive disorder, and severe intractable and disabling anxiety. Medical disorders such as Huntington's chorea, tic disorder, heat stroke. What are the contraindications? CNS depression, bone marrow depression, hypertension, Parkinsonism, hepatic dysfunction, and glaucoma. Pharmacokinetics. Absorption and distribution. Most antipsychotics are readily absorbed by the gastrointestinal tract. Most are highly lipid soluble and are highly protein bound, and they have high volumes of distribution. The elimination half-life period varies from 10 to 24 hours. The metabolism. Most antipsychotics are almost completely metabolized in the liver. Excretion. Excretion is mainly in urine and also in bile. The mechanism of action. How this both typical and atypical antipsychotic works. They block the dopaminergic signaling in the central nervous system, specifically the type 2 dopamine receptor antagonist, D2 receptor. There are 6 dopamine signaling pathways in the brain, but the far most involved with antipsychotics are mesocortical, from brainstem to the cortex. It is associated with the negative symptoms of schizophrenia. Mesolimbic pathway, that's from brainstem to the limbic system, which is involved with the positive symptoms of schizophrenia. Nigrostriatal pathway, that's from the substantial nigra to the basal ganglia. It is associated with moral planning, and dopaminergic signaling within it leads to purposeful movements. The D2 blockade of the nigrostriatal pathway can cause extrapyramidal symptoms. This is the pathway affecting mostly in Parkinsonism. Tuberoinfundibular pathways, that's from hypothalamus to the pituitary gland, which releases dopamine and inhibits prolactin release from the pituitary gland. Adverse effects of antipsychotics. It is extrapyramidal symptoms, or also known as extrapyramidal syndrome, which includes many symptoms together. Neuroleptic induced Parkinsonism, acute dystonia, akathisia, tardive dyskinesia, and neuroleptic malignant syndrome. The first one is neuroleptic induced Parkinsonism. From the word here, neuroleptic, it is another name for antipsychotics, which you have seen little before. So the medication, usually the high potency medication, so the typical antipsychotic would lead to Parkinsonism-like symptoms. So the patient presents with rigidity, tremors, bradykinesia, stooped posture, drooling, akinesia. Akinesia is a loss of ability to move the muscles. Ataxia is a lack of muscle control and coordination. And this condition can be treated by giving anticholinergic agents. The normal medication given is trihexyphenidyl, benztropine, and biperidine. And the next symptom is acute dystonia. Dystonia is abnormal muscle tone. What happens here is there is a slow, sustained muscular spasm which leads to involuntary muscle movement. The muscles of the neck, jaw, and the tongue are affected first, and then the entire body. So there is a opisthotonous position observed, and also there is oculogyric crisis. The oculogyric crisis, the upward and lateral movement of the eye is seen. This acute dystonia also can be treated with anticholinergic medications and also with antihistaminergic medication like doxepin, dopamine agonist, bromocriptine, beta-adrenergic antagonists like metoprolol, and benzodiazepines. The next is akathisia. Akathisia is the patient himself is saying about is a subjective feeling of the muscular discomfort. So there is a muscular discomfort which the patient himself feels. He becomes agitated, he becomes restless, and is a sort of dysphoric. That means a state of feeling uneasy. This patient can be treated with propranolol, benzodiazepines, and clonidine. And tardive dyskinesia. Tardive dyskinesia is a little delayed adverse effects of antipsychotics. It consists of abnormal, irregular, chorioathetoid movements. So what usually is seen here is the muscles of the head, limbs, and the trunk. The previous one, acute dystonia, the neck, jaw, and tongue, and the entire body was involved. And here it is the, the head. The head is affected, limbs, and the trunks. And what you see with the patient is when he has tardive dyskinesia, the facial grimacing, he will be putting his tongue out, he will be smacking his lips, he will be putting out his cheeks, and his grimace will be different. So that is what you would observe. And also, like when he is standing, you would be like sway from side to side. And also there will be, he will thrust the pelvis. So because it affects the limbs and also the trunk and the head. And that is what happens in tardive dyskinesia. And when it comes to neuroleptic malignant syndrome, it is very important for us because we can prevent it. We have to, because it is a rare condition, but it is a serious condition. And it also, the patient who gets high potency medication, antipsychotics, would develop neuroleptic malignant syndrome. So what happens here is there is a rapid onset of motor, mental and autonomic disorder. When I say rapid, it is between 24 to 72 hours the symptoms occurs. And when it is motor discomfort, you will see generalized muscular hypertonicity and stiffness of the muscles in the throat and the chest, which can lead to dysphagia and dyspnea. Mental disorders like akinetic mutism, stupor, impaired consciousness, and autonomic discomfort, hyperpyrexia. When you take the temperature, patient would have 100, 105 above, unstable blood pressure, tachycardia, excessive sweating, salivation, urinary incontinence. And in the blood, you would see that increased level of creatine phosphokinase and also increased WBC count. Apart from that, patient also would present with secondary problems like pneumonia, thromboembolism, cardiovascular collapse, and renal failure. Symptomatic treatment is given, but before that, stop the medication and supportive care, symptomatic care, and the drug by name dantrolene is given, diazepam is given, bromocriptine is given. So these are the extrapyramidal symptoms. What you have learnt in the previous slide, you would appreciate in this neuroleptic induced Parkinsonism. Here you can see the person with stooped posture and stiffness of the muscles and unsteady gait. Here acute dystonia, it is a muscular spasm which has led to involuntary movements. You can see the upper portion of the body and the neck is rigid here. Akathisia, you can see the person is agitated. And here it is tardive dyskinesia. You can appreciate the chorioathetoid movement of the muscles of the head. You can see here the grimace, and here it can be chewing or sucking, and what you see is smacking the lips, and here you see sticking out the tongue, and what she's doing is putting out her cheeks, and this also looks like that. Autonomic side effects: dry mouth, constipation, cycloplegia is the paralysis of the ciliary muscles of the eyes, mydriasis, dilatation of the pupils, urinary retention, orthostatic hypotension, impotence, impaired ejaculation. Seizures, sedation, other effects, agranulocytosis, and cyalloria, it is the drooling of the saliva, weight gain, jaundice, contact dermatitis, and photosensitivity. Nurse's responsibility, general responsibility. It goes with other medications also, other psychotropic medications also. Nurse must also remember the 10 rights in giving medication, namely the right patient, right medicine, right dose, right route, time and frequency, right patient education, right documentation, right to refuse, right assessment, right evaluation, all that. Apart from that, we be very particular in checking the written order written by the doctor to ascertain that that is the particular medication she is going to administer to the patient. And about the drug containers. See, you are with patients who are mentally disturbed and you are going to administer medication to them, and see that the containers are tightly closed and labeled. It is tightly closed because the patients, there is alterations in the thought process, the behavior and the mood. So you must be very careful. Avoid access to drug cupboard. So as I said the reason. So the patient at any point of time would, become uh, irritable, violent. We do not know. So better don't keep the medication cupboard near to the patient. And always the drugs have to be kept under lock and key. Nurse's responsibility during drug administration. Reassure the patient. Nurse is going to administer the medication. She is with a medication tray. But what about the patient? The patient has just had his night medication. He is not still out of, his dizziness. He is still feeling drowsy. He is feeling not so good. He is not able to do on his own his day-to-day activities. He is fed up of taking the medications. So at that time, he needs reassurance. It is not that the drug is just administered to him and the work is done, but understand the patient, listen to the patient to know how he is feeling. He might be sharing with you the side effects of the medication, or sometimes he may be sharing with you the improvement he has seen in some aspect. So give chance to the patient. Encourage the patient. Address by name. When patient is addressed by his name, his self-esteem is increasing. He feels good about it. He feels he is wanted. Do not leave drug tray near the patient, because there is tendency, if the patient is suicidal, if he has suicidal thoughts, he might collect the medication and keep. Or because patients with psychotic symptoms do have disturbances in thought, behavior and mood, he might take the tablets and swallow. Do not allow patient to go anywhere with the drug. If you allow the patient to go with the drug, he might throw the drug and he may not take the medication. And nurse's responsibility, once you give the medicine to the patient, you stand there and watch the patient, let him take in front of you, swallow the medication, observe the patient, and then leave that place. Check vital signs. Vital signs are very important because by checking vital signs, you might identify earlier signs and symptoms of adverse reactions of antipsychotic medications. Like you check the temperature. If the temperature is increased, and you would, that tells you that you have to, like after 4 hours, depending on the patient, to go and check the temperature. Maybe the temperature is increasing. Maybe that is the early symptoms you are seeing for, malignant syndrome. And you have to check patient's pulse, patient's respiration, patient's blood pressure. When you get oily injection to administer, take care when you are mixing the medicine. Mix it well. And selection of the site. If the amount of the medicine is just less than 1 ml, you can go with deltoid muscle. If more than that, up to 3 ml, you have to use only gluteus muscle. So all these are your responsibility during drug administration. How do you manage side effects? Sips of water, ask the patient to take sips of water. This will, help when the patient has dry mouth. An application of glycerin or coconut oil on the lips, patient would feel comfortable. And when you ask the patient to take mouthwash, or you help the patient to take frequent mouthwash when the patient is having sialorrhea, that is the drooling of saliva. Mostly you see when the patient is on typical antipsychotics, you see the patient having drooling of saliva. That is one of the first symptoms of EPS, if you remember. neuroleptic induced Parkinsonism. So patient would have drooling of saliva. So that is the time when frequent mouthwashes are given, patient feel good and it reduces. And high fiber diet, it prevents constipation. It is one of the side effects. Also, you encourage patient to take more vegetables and fruits. And when he takes fruits like cheap fruit like papaya, it is very high in rich in digestive enzymes which can prevent jaundice, because jaundice also is one of the side effects of antipsychotic medications. And ask the patient to take adequate fluid intake and sometimes even more fluid intake, because dehydration, is one of the triggering factor for a neuroleptic malignant syndrome, which is one of the serious adverse effect of antipsychotic medications. And also, if you help the patient to take enough water and be hydrated, jaundice can be prevented. Promotion of normal voiding pattern. When you help the patient to have a normal voiding pattern, because one of the side effects is retention of urine. So that will be avoided. Maintain intake output chart. Use of sunscreen, because one of the side effects is photosensitivity. You help the patient, encourage the patient not to go out during sun, but unless it is mandatory. If he goes during sun, he has to wear a sunscreen. How do you ensure patient safety? Not to abruptly stand from sitting position. Orthostatic hypotension can be prevented if you allow the patient, or to teach the patient, if he's lying down, before he gets up, he has to sit for a while and then get up. Avoid driving, operating machinery, and prevent excess exhaustion, because patient would be drowsy. So when he is dizzy, drowsy, if he drives or operate machinery, that might lead to injuries. And when he is exerting himself, it is one of the triggering factor for neuroleptic malignant syndrome, which is a serious adverse effect. So we can prevent the patient. And of course, patient has to be encouraged to perform minor activity. Seizure precautions. You have to protect the patient from injury. See that the bed is low, side rails are there. You are taking care of the environment stimuli whatsoever it is. And if the patient is on seizure medications, anticonvulsants, see that it is administered in time. You have to teach the patient on drug interactions. Prevent over-the-counter medications, because patient is on antipsychotic medication. So when the patient is on antipsychotic medication, when he goes and gets from a pharmacy outside, that person does not know that patient is on antipsychotic medication. So some of the medication interact and give rise to, undue complications, fatal complications. So tell him not to take any medicine without the doctor's prescription. And also, whichever language he can understand, make it simple and explain to him, and especially to the caregiver. If he wants to take, it must be brought to the notice of the doctor. Avoid alcohol and other drugs. That's very important. If the patient is administered clozapine, if he is on clozapine, what must you do? You have to take care of the patient, because patient is likely to get agranulocytosis, one of the side effects. So patient has to be told to report if there is sore throat, fever, and as a nurse you have to monitor the blood counts, and you have to every week, preferably, the WBC count has to be checked. If the WBC count is less than 3000 per cubic millimeter of blood, better stop and inform the psychiatrist. That is important. Nurse has the responsibility to educate the patient on the following aspects. Importance of drug compliance. She must build good rapport with the patient, give simple instruction. Before giving the education, assess patient's knowledge about drug compliance. The patients commonly give certain reasons for discontinuing prescribed medications. They are the side effects of the medicines. They say they feel dull and lethargy all through the day. And the cognitive functions are slowing down. Sexual dysfunctions, denial of need for taking medicines, fear of becoming addicted to, interference with work, illness. When they have suspicious thoughts, they say the drug is being poisoned, inability to use alcohol or other drugs, busy lifestyle, and the duration of the treatment itself. Usually it is chronic. Nurse has to motivate the patient to understand the benefits of adhering to medication regime, that it controls the chronic condition of the disease and helps to maintain overall long-term health and well-being of patient. Stress on the severity of non-compliance of treatment. Print the instructions regarding drug compliance and give it to the patient and the caregiver for future reference. To inform immediately if any side effects. This is education regarding side effects. Yes, side effects are real. We must educate the patient on the early symptoms of the side effects. You have seen about extrapyramidal symptoms, autonomic side effects, agranulocytosis. Yes, you know now. So you need to educate the patient how must they identify the earlier symptoms, and then if they find any, not to discontinue the medicines on their own, but approach the treating doctor and they will do the needful. That's very important. Make them understand, educate them on this so that their drug compliance will be maintained. Instruction to pregnant and lactating patients. Both of them must be instructed, giving teaching about the dangers of over-the-counter medications because it will affect the growing child and the child who is breastfeeding. If they come across problems, if they have any complaints, it must be brought to the treating psychiatrist. Regular follow-up. It is vital. Follow-up is vital. Inform the patient what is done during follow-up. You say that the doctor monitors the treatment progress. A medical checkup is done, like it includes the mental status examination, physical examination, investigation lab test, all those things. And it helps the treating doctor to ascertain that the patient is responding good with the prescribed treatment plan. So once the patient is given good education about the need for follow-up, regular follow-up, might be once in a month or once in 3 months depending on the patient. So once he understands the need for regular follow-up, we believe that he will make it up. He will maintain a regular follow-up. Thank you.